Kathya Alonzo, and today's topic is going to be about disorders of fluids and electrolytes, electrolyte and acid-base disturbances in patients with diabetes mellitus. Definition: electrolyte disturbances are common in patients with diabetes and may be the result of an altered distribution of electrolytes related to hyperglycemia, induced osmotic fluid shifts, or of total body deficits brought about by osmotic diuresis. Complications from an organ injury and the therapies used in the management of diabetes may also contribute to electrolyte disturbances.
When our body is working normally, the foods we eat, containing proteins, fats, and carbohydrates, are broken down into simpler, easily absorbed nutrients. One of the carbohydrates is a form of simple sugar called glucose. It is the main source of energy for the body's cells. Glucose circulates in the blood where it is available for body cells to use. Glucose is the main source of fuel for muscles, heart, brain, and other important organs. Insulin helps cells take in glucose and convert it to energy. Insulin is secreted by the pancreas. After it is secreted, insulin attaches itself to cells throughout the body at places called insulin receptors. Once attached, insulin acts like a key on the cell membrane, allowing sugar or glucose from the food we eat to enter the liver, fat, and muscle cells. The glucose in the bloodstream is decreased, and once the glucose is inside the cell, it becomes a source of energy.
Application in medicine. Without insulin, the body starts to break down fat as an alternate fuel. This process produces a buildup of toxic acids in the bloodstream called cetones, eventually leading to diabetes mellitus. In diabetes, glucose stays elevated outside of the cells, resulting in starved cells despite high glucose levels in plasma. If glucose levels stay high, it can cause damage to nerves, resulting in peripheral neuropathies, reduced bone healing, and increased inflammation through reactions that create oxidative stress. Acid-base disturbances. Diabetes mellitus is a life-threatening problem that affects people with diabetes. It occurs when the body starts breaking down fat at a rate that is much too fast. The liver processes the fat into a fuel called cetones, which causes the blood to become acidic.
In order to understand blood sugar problems, we need to review what a hormone is. Hormones are proteins released from parts of the body called glands. They help to send messages from one place in the body to parts that are farther away. Insulin is a hormone that tells the body to store the energy we get from the food we eat. Insulin is made in your pancreas, a small organ located just below your stomach. Insulin levels go up in response to the different types of sugar eaten in your diet. Rising insulin levels allow sugar to be saved as energy, to be used later. Let's take a train ride to try to understand things better. All aboard! Think of the pancreas as if it were a steam engine on an old-fashioned train, heading out for a ride through the mountainside. Insulin is the smoke that the train engine produces as it chugs along on its journey. Passing through the valley, the train glides along its track. The steam engine works effortlessly and continuously produces small puffs of smoke. When it travels up a hill, the smoke increases, but only by a small amount and for a short period of time. This represents the normal, everyday function of the pancreas. When the pancreas is not overworked, it churns out small amounts of insulin. A small hill represents a meal that results in insulin levels going up temporarily. When the train begins traveling up a very steep mountain, the engine kicks into gear. As the train climbs, the engine burns more fuel, and the smoke output begins to rise. Initially, the speed of the train does not change, and the passengers are not aware of the effort required from the engine. This steep mountain represents pre-diabetes. As a person eats more than what is needed, the pancreas has to work overtime and churn out more insulin. The individual does not feel the stress placed on the pancreas. If the train has to continue up the mountain for a long period of time, the engine will start to burn out and the train will slow, decreasing the smoke produced. Similar to the overworked engine, the pancreas can begin to tire out as well. In diabetes mellitus, sugar in the blood is high for several reasons. The pancreas cannot produce enough insulin because it is overworked. Also, weight gain contributes, causing the insulin you have to not work as well. The end result is that sugar from the diet builds up in the blood. Adding exercise to your schedule and eating less sugar in your diet can decrease the stress on your pancreas and improve blood sugar levels.
Pros and cons. Pros. The treatment of diabetic ketoacidosis involves the administration of insulin and intravenous fluids to correct volume depletions. The primary goals of therapy of hyperkalemia acidosis tubular is to correct the disorder, reducing the concentration of potassium and correct the acidosis. The cons of that hyperkalemia is frequently present on admission in patients that have diabetic ketoacidosis, even though the total body potassium levels are reduced.
In this video, we are going to talk about the relationship between insulin and potassium and which one shifts where and when. I'm going to tell you exactly what you need to know about those insulin and potassium shifts for nursing school. Let's do it. Hey there, friend. Christina here with NursingSchoolOfSuccess.com, helping you to raise your grades and have more free time in nursing school. Yes, it's totally possible. So if you're like me, you're struggling with fluid and electrolytes in nursing school, right? And specifically, I had a really difficult time with this concept of insulin and potassium and glucose and what happens to the potassium level when you give insulin, and if there's too much glucose, will the potassium level increase or will it decrease, or what's going on? So we're gonna put an end to all of that confusion right here. I'm gonna break this all down super simple for you. So the first thing you need to understand is that there are two different places that fluids and electrolytes can be, and that is inside of the cell, or the intracellular fluid, or the ICF, or outside of the cell, called the extracellular fluid, or the ECF. Normally, potassium hangs out inside of the cell. Now, I like to think of potassium as a little homebody. It likes to hang out and stay all nice and cozy inside of the cell. So potassium hangs out in the ICF, or the intracellular fluid. But when there's too much glucose outside of the cell, in the extracellular fluid, or the ECF, potassium gets a little curious. It wants to join the party that glucose is having. So potassium then moves outside of the cell to see what all the fuss is about. So let's say you have a patient with hyperglycemia, meaning their blood sugar level is high. What do you think is going to happen with that potassium level? Will it increase or will it decrease? Don't worry, I'm just gonna wait here while you think about it. The potassium level will increase because potassium will have moved outside of the cell, which then raises the potassium level. The potassium isn't hiding away in the cell anymore. It's moved outside of the cell to go to the party that all that glucose is throwing. Now, when that party gets a little too out of control, there's too much glucose around and they're getting a little too rowdy, the police need to get involved. And the police is insulin. So insulin comes and moves glucose into the cells where it belongs. And the potassium, like we said before, potassium is a really big homebody. It doesn't like to shake things up too much or cause a ruckus or anything. It just came out of the cell to see what was going on. And when glucose was having that big party, it just wanted to see what the fuss was about. But now the insulin police is here, it's going to go back into its home, into its cell, so it doesn't get into any trouble. So it's going to move back into the cell. So what is going to happen with the potassium level when insulin arrives? No rush, I'll just pause here while you think about it. If you said the potassium level was going to drop when insulin arrives, you are 100% correct, my friend. When insulin shows up, potassium moves back into the cell out of the ECF, causing the potassium level to drop. Now, why is this so important? Well, if you have a patient with hyperglycemia, like during diabetes or DKA, and you give them insulin, you need to be very careful with that potassium level. You need to monitor it as they're receiving insulin treatment because you don't want that potassium level to drop too low. That can be very, very dangerous. So you need to monitor their potassium level closely when you're giving insulin therapy, along with monitoring, obviously, their glucose levels closely as well. Now, if you found this video helpful, make sure to hit that like button, share it with your friends, and of course, don't forget to subscribe and click on the little bell so you
Issue applied in Ecuador. Diabetes mellitus is a non-transmissible chronic disease with a high prevalence worldwide. In Ecuador, this illness is one of the main causes of mortality, and it is related to many diseases that are produced as a consequence or deterioration from diabetes mellitus due to age, and also because of bad management of the disease by the affected person and relatives.
Diabetes is a disease in which your blood glucose, or blood sugar, levels are too high. Glucose comes from the foods you eat. Insulin is a hormone that helps the glucose get into your cells to give them energy. With type 1 diabetes, your body does not make insulin. With type 2 diabetes, the more common type, your body does not make or use insulin well. Without enough insulin, the glucose stays in your blood. Glucose comes from the foods you eat.
Over time, having too much glucose in your blood can cause serious problems. It can damage your eyes, kidneys, and nerves. Diabetes can also cause heart disease, stroke, and even the need to remove a limb. Pregnant women can also get diabetes, called gestational diabetes.
A blood test can show if you have diabetes. Exercise, weight control, and sticking to your meal plan can help control your diabetes. You should also monitor your glucose level and take medicine if prescribed.
Conclusion. In summary, the dysregulation of glucose homeostasis leads to many direct and indirect effects on electrolyte and acid-base balance. Since the high prevalence of diabetes ensures that clinicians in virtually every medical specialty will interact with these patients, familiarity with related electrolyte abnormalities is important.
What are electrolytes? Electrolytes are ionic minerals, which mean that they are minerals that have a positive or negative electrical charge. The three main electrolyte minerals are sodium, potassium, and chloride. Sodium helps regulate blood pressure and aid in nerve impulses and muscle contractions. Potassium helps regulate heartbeat, muscle and nerve cell functions, and helps maintain a healthy blood pH level. Chloride's main function is to help with fluid balance in the body. Your kidneys, along with several hormones, regulate electrolyte levels. Electrolytes are lost through sweat, urine, and feces. For people exercising more than 60 minutes, electrolyte loss can sometimes be a concern. However, in most people, electrolyte deficiency is rare. Many sports drinks are high in electrolytes, but they usually contain large amounts of added sugar or artificial sweeteners. A great way to replenish electrolytes is by consuming them through foods. Bananas, spinach, and avocados are high in potassium. Sodium and chloride, or salt, is added to many foods such as sauces and soups, making their replenishment easy to achieve. And that is the basics on electrolytes.
Thank you so much for watching. I hope you like it.